Hello everyone, and welcome to my presentation on sexually transmitted diseases with a focus on chlamydia and gonorrhea. My name is Janai Alexander. I'm an LPN to BSN program student at Indiana State University. This is my health education project for community health nursing. We will begin discussing our population at risk. Individuals who are sexually active are at risk for sexually transmitted diseases. Today's learning objectives include: Number 1, the learner will be able to define sexually transmitted diseases, or STD for short. Number 2, the learner will be able to identify the symptoms of two common STDs, chlamydia and gonorrhea. Number 3, the learner will be able to list complications of untreated chlamydia and gonorrhea. Number 4, the learner will be able to describe the screening process of chlamydia and gonorrhea. Number 5, the learner will be able to identify treatment of chlamydia and gonorrhea. And 6, the learner will be able to explain the prevention of chlamydia and gonorrhea. Please take a moment to pause this slide. If you haven't already done so before this presentation, there is a pre-test. Please copy the link below into your browser or phone, or there's a link in the description below. Let's begin with defining sexually transmitted diseases. Sexually transmitted diseases are diseases spread through sexual contact, and that can be through vaginally, anally, or orally. They are caused by bacteria, parasites, and viruses. On the top right of this slide, this is the chlamydia bacteria, and on the bottom of the slide, this is the gonorrhea bacteria. Sexually transmitted diseases can be spread by individuals who are sexually active. Next, we will identify the symptoms of chlamydia and gonorrhea. Chlamydia and gonorrhea have similar symptoms. In women, they can present as abnormal vaginal discharge, which can vary in color from white to green to yellow, and there can be a foul odor. There can also be burning while urinating and painful intercourse. In men, it can present as discharge from the penis, burning while urinating, or burning or itching around the penis. For rectal infections of chlamydia and gonorrhea, it can cause rectal pain, discharge, bleeding, and painful bowel movements. In this next slide, we'll list and discuss the complications of chlamydia and gonorrhea. If left untreated in women, it can lead to pelvic inflammatory disease, ectopic pregnancies, pelvic pain, and infertility. If left untreated in men, although it is uncommon, an infection in the epididymitis can occur, which could lead to infertility. Next, let's discuss screening for chlamydia and gonorrhea. There are many places to get screened, like a health center, your doctor's office, or a local urgent care. There are even pharmacies or minute clinics that you can get screened at as well. There are lab tests to diagnose chlamydia or gonorrhea. Your healthcare provider will ask for a urine sample. This can be 2 different urine samples on the same day, usually your first urine, which is known as a dirty catch, and then you'll go ahead and wipe the area and urinate again into a separate cup, which is known as a clean catch. For women, there also may be a cotton swab that you can either do yourself or have the healthcare provider do to you. Either the urine or the cotton swab will get sent to the lab, and your test results can usually come back within a day, which will either confirm a negative or positive chlamydia or gonorrhea result. Now we will discuss the treatment of chlamydia and gonorrhea. Since they are both bacteria, your healthcare provider will prescribe antibiotics. Antibiotics are the only way to treat chlamydia and gonorrhea. There are two options in length of antibiotics that your healthcare provider may choose. The first option is a one-time dose antibiotic, and you will need to wait until 7 days after taking that medication before you begin to have intercourse again. The second option is a week-long course of antibiotics. You will need to wait until you have completed all doses of your medication to begin to have intercourse again. Reinfection is common, so if you begin to have symptoms, do not hesitate to get retested. You want to make sure that you finish all of your antibiotics, and for women, it is possible to get a yeast infection, as antibiotics cannot differentiate good or bad bacteria. So it is important to either ingest a probiotic or something called kefir that you can buy at the grocery store. If you test positive for a sexually transmitted disease, you will need to let your sexual partners know so that they can get tested and treated as well to prevent any of the complications associated with chlamydia and gonorrhea. Lastly, we will talk about prevention. The only way to prevent sexually transmitted diseases are to abstain from vaginal, anal, or oral sex. There are two ways that you can greatly reduce and lower your chances of transmission or spreading sexually transmitted diseases. The first way is to use condoms correctly, and the second way is to maintain a long-term mutually monogamous relationship with a partner who has tested negative for sexually transmitted diseases. On this slide, here are some additional resources on chlamydia and gonorrhea from the Center for Disease Control and Prevention and Medline Plus. There are fact sheets that are easily accessible via PDF file that you can save to your phone, or they're printable if you need them. Please take a moment to pause this slide as it is time to take your post-test to check your understanding. There is a link below that you can copy and paste into your browser, or click the link in the description that says post-test. If there are no questions, this concludes my presentation on sexually transmitted diseases with a focus on chlamydia and gonorrhea. Thank you for listening. My name is Janai Alexander. I am an LPN to BSN student for Indiana State University, and this is my health education project for community health nursing.